Hi, my name is Shruti Shah, and my partner is Shikha Adhikari. Unfortunately, her network is down, but both of us are in 11th grade. We're in American High School, Fremont, California. Um, we're doing a STEM project. Our project is Health AI. So we are addressing the fifth NGN 2120 goal, which involves improving healthcare services in underserved areas where people are most susceptible to deadly diseases or more likely to spread them, such as in the Bronx, New York, and Oakland, California. We are looking for investors and social entrepreneurs to help us finance our idea and spread it to health administrations across the country and use the help from the government as well as like other investors and soon globally using artificial intelligence and funding for local care centers for homeless and underserved people who do not have access to healthcare facilities. Okay, so basically our problem definition, so there's a limited number of healthcare physicians, doctors, nurses, and hospitals in medically underserved areas, and because of the limited resources, there's no right treatment, and many people like stay ill, and many people are like not treated properly, and this leads to higher mortality rates in these areas. And so, with over 20 million people that are impacted in the U.S. That are medically underserved, and the cost increasing, more people are going to be in these situations, and they're going to be stuck in situations where they can't afford healthcare and they can't get treated properly. And so our customers are like investors and high medical professionals that will invest in our idea to reduce costs and treat patients as accurately as in-office visits. Okay, so our solution is through the use of AI, machine learning, and biotechnology, we can create a device that diagnoses patients as accurately as humans, reducing the need for human resources and care by doctors, nurses, and physicians in these areas. And obviously, there's no replacement for personal care and these doctors, but this idea is like the next best thing. And this idea also removes human and doctor error that we see constantly in hospitals in such and we are like, so basically we are the bridge that closes the gap between healthcare and diagnosis in developing areas, and this has the potential to impact communities globally. Okay, so our influence goal, we are here today to convince you to invest in this idea, which has the potential to save millions of people around the world. And we need money for developing new algorithms to combat various diseases. And these devices not only use AI to treat and diagnose these diseases, but they also are used to assist the elderly and to assist the people with their needs, and it'll inform them. It'll inform the public on how to further take action with the symptoms that they have. And so we are going to convince you that our proposal is worth $10,000 in seed money, which is used to develop these new algorithms and used to develop better devices for the patients. So our financial model, so we these devices will be bought by healthcare companies as well as like investors and as well as like the patients. So it's like it'll go up on the market, and we will partner with the World Health Organization to provide stronger marketing for them. And these devices will be $50 per unit for like smartwatches and smart devices. It'll range between that, and we'll also partner with government agencies and that will supplement their services. Like as you can see in this chart, like more than 2/3 of the budget that the government uses is towards healthcare, and so we could help lower that by using these devices and selling them. So you need less money that goes towards like patient care. Okay, so
I'm sorry, Shruti, it looks like you skipped a slide that covers the actual device.
Oh, that's like later.
For this one. Okay.
Yeah. Okay. So the sales and marketing. So we're going to get the customer's attentions through like its convenience and affordability, and using advertising, promoting it in hospitals and in certain areas that this is really in need. And then the stakeholders are like people who cannot afford the healthcare, and like senior citizens who have trouble with these with going, like having affording healthcare in insurance. Ah, wait. Oh yeah, okay. So this is basically, you're right. I did skip a slide. Um, so this is just an example of like the type of devices we would like apply we would put the applications on. And so basically the application is to program these like algorithms and have actual assistance to the people who can be monitored like on a regular basis. And like we can like also partner with these devices to like um to put the applications on them, and yeah, for them to be at use. Okay, yeah, so the competition. So Harvard Medical School is currently has an app that like has AI imaging tools that can screen like x-rays that are available on it. And they also are combating the same issue of helping people in underserved areas. And healthcare companies also are opposed to this idea because they would be like losing business and members. And the WebMD is like an online platform where doctors and patients meet virtually. But the advantages that we have with this idea is that it is a physical, affordable device that can be given to these areas, and they provide better assistance for the people. And most of the people like that already have smart devices, and it's actually pretty cheap. And when they download these applications, yeah, they're provided with really good assistance, and they're physical devices that can be monitored, that can monitor people. And yeah, which is way more effective than just like a regular like app. Yeah. And so basically, we as a society need to take care of each other, and especially in these uncertain times, providing support for those who like most need it are is very essential. And just like there's like a higher force that we all believe in, there should be and a higher power that people believe in, there should be a safety, and there should be comfort in people, in those people who also can't afford it. um, and we should be able to provide support to them, and this idea is like is targeted towards that. Thank you.
So I have a question for you. You mentioned this is a sort of part hardware, part software offer. So why hardware? What does the hardware do that a Fitbit or an Apple Watch doesn't do? What are you thinking there?
So
Why not just use some things that are already out there?
so the application that we were creating was basically for like that it has assistance that could like monitor people, like instead of just and diagnose the like people. um and with like the actual hardware devices, it'll be easier to to um connect with the people, because like if it's like a wristband or like something that is like tangible, it's easy to like see, and it's easy to like make the patients itself like aware of the like make them aware of like what they have and like how they can contact other people.
Can you, so Shruti, can you tell me, so I go into a clinic, right, or whatever it is. I'm a patient, I need, some sort of medical services. What is it that's going to be happening? Like, what does the device do to me as a patient? Like, what does that even look like?
Okay, so basically this device it's not necessarily, you don't have to go to a hospital. That's one of the upsides. It's something that's on the market for people to get to their houses because they can't afford like healthcare and to go to hospitals and get treated properly. So yeah, so these devices will be physically like given to the house, and through these devices the patient will be able to, or like the person will be able to check in and like get like not treated but like get diagnosed, and will be able to be aware of like what symptoms they have and how they like how they can take further action.
Got it. Okay, so I buy this at like a local store or what have you, or Best Buy, or I don't know, any place I would buy this online. It comes to my house. And then what is it doing for me? Is it taking my blood pressure? Is there a video application to it? Like, what does that look like?
Okay, so right now we are still in the process of deciding that, but with like the applications we can install in these smart devices, we can probably, we can take like the blood pressure and like we can sense abnormalities in the person, and like certain features will be able to detect certain like flaws or like certain fluctuations that they have in
any abnormalities, any issues that you would have. Okay, and then that would alert my doctor, that would alert me. Like what happens? It goes to a phone. What does that look like?
Well, for right now we were thinking that it would it could send or like connect to some type of like higher care, like a doctor, or like they could get further information on the device on who to contact. And so like this would be a good device, because instead of like patients who can't afford healthcare go in for regular checkups, they can go in for the treatment only when it's like absolutely necessary, and this device will help protect that.
Okay, got it. Thank you.
Okay.
So just one additional question. So if I understood you correctly, your target audience for this particular device is actually for people who could not afford to go get healthcare like at their regular doctor, right?
Yeah, and like insurance, and like because that's also really increasing and it's going in bigger in numbers. And so with type of AI and like these devices, we can really combat that issue of like spreading diseases and all that.
Right. So have you thought about the idea of what you might see today at some supermarkets and some drugstores, like, a device that takes your blood pressure? Could you see, expanding on that, put in your particular device, or creating a device using those particular platforms so that people who couldn't normally go see a doctor can go into their closest supermarket or drugstore and be able to leverage what you put in terms of things that you can monitor, whether that's blood pressure, temperature, etc., into a system like that where they could get those things measured, and then maybe connect those customers to maybe the closest doctor that maybe might offer low or reduced health care costs?
So what is your question?
So I guess my question is, could you see leveraging what you have into machines that exist today at a supermarket that might measure, for example, your blood pressure?
Yeah, we could definitely use those to help like elevate and modernize this like device and these applications. And also like, I had one more thing.
So my thought is that just because your target audience is folks who normally could not perhaps afford to go see their doctor, right? unless they really, really, really need it to. I'm just wondering if you might want to leverage that technology so that they can go to some place that they're comfortable with already and get, you know, some more information about their condition before going seeing the doctor.
Yeah, that would be a really that would be a really good next step, and we could also use the support from like the investors like you guys to get the seed money to use these algorithms and to train the application to also connect with the nearest local hospital that's like close by, and yeah, and we could definitely use the other devices for like blood pressure as like leverage to create a better like assistance and better treatment for this new application.
I think you guys have a great idea. Just got to work through the use cases.